May you find happiness and peace, and may your home stand the test of time.
Hello guys, welcome back to my channel. My name is Mary. Today I'll be reacting to ex-abortion doctor tells the shocking truth about abortion. So guys, without further ado, let's get started.
This investigation of Planned Parenthood is based on false premises, one after another after another. It's time to stop wasting time, get on with meaningful work, and stop picking on women and trying to take their choice away. I yield back the balance of my time.
The time of the gentleman has expired. We welcome our distinguished witnesses today. Do you and each of you swear that the testimony that you are about to give shall be the truth, the whole truth, and nothing but the truth, so help you God? And I'll now begin by introducing today's witnesses. The first witness is Dr. Anthony Levatino. Dr. Levatino is a board-certified obstetrician gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OB/GYN at the Albany Medical College. And Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and a ½ inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times, sometimes a little face comes back and stares back at you.
Wow.
Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.
One more question, Dr. Levatino. Why did you end your practice of doing abortions?
I did over 1,200 abortions over a 4-year period in private practice, not counting the ones that I did during my training.
Wow.
I met my wife during my first year of training at Albany Medical Center. We got married about a year later and found that we had an infertility problem. After years of failed infertility treatment and several years trying to adopt a child, we were blessed with adopting a little girl that we named Heather in August of 1978. As sometimes happens in those situations, my wife got pregnant the very next month, and we had 2 children 10 months apart. 2 months short of my daughter Heather's 6th birthday, she was killed in an auto accident and literally died in her arms in the back of an ambulance. Anyone who has children might think they have some idea of what that feels like, but unless you've been through it yourself, you have no idea whatsoever. I know people find it hard to believe, but what do you do after disaster? You bury your child and then you go back to your life. And I don't remember exactly how long it was after my daughter died that I showed up at Albany Medical Center OR number 9 to perform my first second trimester D&E abortion. I wasn't thinking of it as anything special. This was routine to me. But I reached in, literally pulled out an arm or leg and got sick. You know, earlier on I described stacking up body parts on the side of the table. It's not to, gross people out, to use a simple term. When you do an abortion, you need to keep inventory. You have to make sure you get 2 arms and 2 legs and all the pieces. If you don't, your patient's going to come back infected, bleeding, or dead. So I soldiered on and finished that abortion. And I know it sounds, as I said, hard for people to believe, but I'm telling you straight up my experience. You know, after over 1,200 abortions, first and second trimester up to 24 weeks and all the rest of it, and being very dedicated to it, for the first time in my life, I really looked. I really looked at that pile of body parts on the side of the table. And I didn't see her wonderful right to choose, and I didn't see all the money I just made. All I could see was somebody's son or daughter. And I stopped doing late-term abortions after that, and several months later stopped doing all abortions.
Thank you.
Wow. Guys, this is heartbreaking, you know. My sister just gave birth. That was I think a month ago, and I noticed she actually gave birth through CS. The stress, the trouble the baby caused before coming, and even after, you know, giving birth, and the workload, the sleepless nights and all that she has to pass through. So seeing someone that his full-time job is, you know, terminating children, you know, killing as many children as possible simply because, you know, that is what you have been trained for, that is what you are there to do. It's shocking, you know. Sometimes we do so many things based on our profession, even if it's not right. But this is heartbreaking. This is really, really heartbreaking. This is something I think everyone needs to watch. This is something pro-abortionists need to watch. Like, you need to see this for yourself and know that, okay, this is what I'm promoting. This is what I want people to indulge in. It does not matter how early it is. The thing is, it's still the same thing. If it's an embryo, the embryo is growing to be in his 12th trimester, you know, someday. So don't cut that life short. Bring them to this world and let them choose for themselves if they want to stay. At least suicide is not an offense, but killing is an offense. Like, taking someone's life is an offense. But this is shocking, and I'm very glad it's coming from a doctor. At least it's coming from someone that has the experience. I think this is someone that is supposed to go out there and teach people, you know, make them see reason why this shouldn't be condoned or this shouldn't be accepted in the society. It does not matter how we paint it. Sometimes I know that the stress might be what we are not planning for, because no one wants to bring a child when they are not ready to cater for one, or you've done the deed. The child is on the way. The thing is, you have 12 months, or you have 9 months to prepare for that child. So 9 months is a very long time to at least save up something that will start the child's life. There's a beautiful one, even if it's emotional, but it's indeed worth watching, and it's indeed educational. I learned a lot, and I've seen reason why I need to keep on pushing for this anti-abortion, because it's something that we don't need to, you know, allow the society to keep on indulging in. Well, let me know what you think in the comment section. If it's your first time visiting the channel, click on the subscribe button. Thanks for watching, and remember this.